Okay, guys, welcome back. So, in this unit, we'll get into some of the benefits of physical activity and talk about again how physical activity is strongly associated again with this, mortality risk, morbidity risk, and also disability, right? And how these things are kind of dynamically related to each other. The associations are pretty strong. So, just one thing I want to make sure that we just appreciate: movement is medicine, right? The connection between physical activity and health status has been well established. A lack of physical activity is associated with numerous chronic conditions, notably cardiometabolic diseases, which we're thinking about, our obesity, our heart disease, hypertension, so on and so forth, diabetes, which of course are the leading cause of mortality, morbidity, and disability, right? However, physical activity is also associated with certain cancers, chronic pain, osteoarthritis, osteoporosis, cognitive function, anxiety, depression, and many of those chronic conditions may also contribute to lower levels of physical activity themselves. So there's this bi-directional relationship between physical activity and chronic disease, and then of course mortality, morbidity, and disability. Therefore, it makes it pretty apparent, right, or pretty clear that maintaining adequate levels of physical activity across the population is arguably one of the most important public health goals, right? They're, pretty much our leading causes of mortality, and especially morbidity and disability, right? Strong association and even causative relationship, especially for our cardiometabolic diseases, with physical activity. So if we can get people more active, we can, significantly or have significant effects on the cost burden and care burden of managing those conditions in our healthcare system. So here's a graph here, which I hopefully will illustrate this point of how important it is to be active, and honestly, how really minimal investment we have to make in terms of being more active to get some reward. So on the left, we've got some great data by Mads Sager. It was published in JAMA a few years ago, looking at the effects of fitness on mortality. Now, fitness is kind of a surrogate measure for physical activity. Obviously, the more you participate routinely in physical activity, the likelihood of you being more physically fit, and this is really pertaining more to cardiorespiratory fitness or peak VO2. So the more active you are, more likely you are to have a higher peak VO2 or higher fitness level. And so you see here, it's this, it's a straight linear relationship, right? We move, to being higher levels of fitness. We see we see greater reductions in mortality. And there's been some reports that relationship, there really is no limit. The more fit you are, right, the lower your mortality is going to be. But we can see here, pretty big jump from being the least fit, even just to slightly below average. And probably what's even more appealing is this data, looking just at physical activity, irrespective of whether or not this translates to an effect on fitness, which it typically does, but just looking at participation, right? Just looking at participation, we see the same relationship, right? Again, moving from doing absolutely nothing per week, right? So it's weekly physical activity, to doing something, right? We see a major reduction, right? And then really our moderate levels of activity, our recommended guidelines fall in here, right? So we see that even modest levels of activity, right? You get the biggest, you get pretty significant reduction in mortality, and not much more benefit from being exceedingly more active, moving further to the right here. However, probably what's the most appealing is that, again, if we go from here, doing nothing, to being even below our recommended levels, right, we see the biggest reduction, right? And that's a huge selling point, that you don't need to make a large investment in being more active to see some pretty great returns on that investment, right? Some pretty great dividends, right? Or returns. So again, something really is better than doing nothing. Getting just to a moderate level is pretty good. It's where we want most people. And obviously, there's other benefits from being more active and being more fit. But even if you're just moderately active, that's really really good. But even if you don't, you're still doing better than doing nothing, right? So it's a pretty there's very rare to have relationships like that in medicine, in human biology and physiology, where we've got just typically the more you do within reason, obviously, the better you're going to get. Now, obviously, we mentioned cardiometabolic diseases like diabetes, hypertension, obesity, strong connections. I think everyone's aware of that. Obviously, we see reductions in blood pressure. We see, lower incidence rates of cardiovascular disease. Of course, the mortality benefits, reductions in body weight, cholesterol, all these different things. However, again, there's benefits on neurological, affective domain, anxiety, depression, cognitive function, right? All strongly associated with physical activity participation. Certain cancers, even, right? Prostate cancer, breast cancer, there's a connection there, a strong one. Musculoskeletal, right? Like you mentioned, osteoporosis, osteoarthritis, disability, right? The more you're moving and stretching and contracting and, your muscles and loading those joints within, again, a tolerable range, like they're going to get stronger, right? And again, these relationships that we're seeing, you don't need to do that much. Again, moderate levels are pretty good at return on our investment, and just going from nothing to something is a huge benefit. So what is enough, right? How much is enough? Well, the CDC recommends for weekly activity 100 minutes of moderate intensity aerobic activity, or 75 minutes of vigorous. So people may ask, well, what does that even mean? We'll get into strengthening. We also recommend two sessions of strength training per week. We'll get into the aerobic component in a bit. So moderate intensity would be if we were walking, for example, we can use a thing called a talk test. So talk test for a moderate intensity, right? So if you're talking while doing that activity and you're still able to get out a full sentence, but it gets a little bit more challenging, right? That would be a moderate intensity activity. Light intensity would be like you're walking, it's not a problem. You can talk and walk, no problem at all. Moderate intensity, you can still do that, but it gets a little bit more challenging. We've probably all experienced that. And here's some examples of activity where you might see, or for most people, will be a moderate intensity activity. So walking briskly, 2.5 miles an hour, ballroom dancing, yoga, tai chi, cycling in a lower than 10 miles an hour. That's a moderate intensity activity. But we like using that talk test because it's pretty individualized. It's pretty easy to remember. Now, high intensity would be you're working at such a high pace that you can't even get a word out, right? You don't have enough air to spare to talk. So that would be an example like running, right? Or speed walking maybe, or swimming laps, cycling faster than 10 miles an hour, right? And it gets relative for each individual in terms of the type of activity, but the intensities and the talk tests still hold up, right? So at any time you're, again, working out so hard that you don't have any room to, any air to spare to talk, that's high intensity activity. Anytime where you're still able to talk, but it's a little bit difficult, moderate intensity. If you can walk and talk no problem without any difficulty, that's light intensity. Another way to classify is the thing we call the RPE scale, or the rating of perceived exertion. You may see this, the traditional Borg scale from 6 to 20. I always find this one a little bit easier. It would technically go from 0 to 10. 0 is how you feel at rest, not doing anything. Where 10 would be the most exhausted you've ever felt in your entire life. Like, I gotta stop immediately, right? For moderate intensity, you kind of want to be, again, like moderate, middle, 4 to 5 on that scale of 10. Vigorous would be 6 to about, 8, roughly, right? Or really anything above 6. So anything 4 to 5, about mid-range, we're calling a moderate. 6 or above, we're in that vigorous domain, right? So that's really kind of challenging stuff. And then there's strength. So people, again, like strength is part of this now too. It's a strong, no pun intended. It's a key point of emphasis for most public health agencies because muscle mass, bone mass are really crucial as well for long-term health. Muscle strength is inversely and independently associated with all-cause mortality. It just makes sense. Like if you're able to do more things, if you're stronger, it's going to translate to more independence. Again, we know that our muscles are really important for glucose homeostasis. So again, the stronger you are, the better off you are typically. And we've seen it in clinical populations too. So not just general population, general health. We see it in patients with obesity. We see it in patients with heart failure, COPD. So muscle strength is quickly becoming one of a key point of emphasis in public health. It's already part of our guidelines here. So here's just a quick snapshot from the CDC, what they recommend that people do. Again, 150 minutes of moderate intensity activity. Again, this could be anything that gets your heart beating, right? So they got some examples: cycling, walking the dog, gardening, that counts, swimming, and muscle strengthening exercises. That's going, lifting some weights, doing some things that are building strength. Really, we just want people to move more and sit less, right? So again, and we're saying any amount counts, right? So previously it was we had to get, 5 minutes or more, or 10 minutes or more an hour. Saying, hey, anything counts. Anything counts because the data does support this. Well, hopefully this conveys again the intensities and why these things are important. What we'll get into is, well, why doesn't everyone just do this, right? Because it's a little bit more complicated than I think people realize. So we'll end here and we'll start in that next section. Some of the barriers and why do we see, again, obviously there are numerous or maybe innumerable benefits of physical activity. It seems like it's something very simple, right? Like the Notebook, it's not that simple. But as we'll see here with some of these barriers that have been identified in the research, it isn't that simple, right? There's a lot of factors at play here that translate to why physical inactivity, was a problem or it has been a problem, and why it still remains a problem for so many across the population.